Well, still many unknowns with this virus, and now doctors are trying to figure out what the long-term effects could be. Only on 7, Brittany Hope talked to a doctor at UNM about who's most at risk of being sick for a long time.
The CDC says you are more at risk of getting really sick from the coronavirus if you're older or have other health conditions, things like cancer, diabetes, heart problems, and obesity. But even if you're young and healthy, you could still face long-lasting effects.
We think there are going to be some long-term effects, but we don't know enough yet, in part because we just haven't had a long enough time after people have had COVID.
This virus has only been around for 5 months or so in the U.S., so research on how people's health could be impacted in the long run is still in the works. But Dr. John Femling at UNM tells me, based on the data and research so far, you can break it down like this. 80% of people who get COVID will likely have mild symptoms, and roughly half of those people will probably have some lingering illness for a couple months. It's the other 20% he's worried about. He says about 5% will be really sick and maybe die. The rest will have heart and lung issues that will keep them in the hospital for a while and will likely need rehab. Dr. Femling says this group may suffer strokes, heart failure, blood clots, kidney damage, even PTSD, or issues thinking clearly. But what do those long-term effects look like for people who are younger or who don't get that sick?
There's some pretty good data that in probably over half of people, they have inflammation of their heart for at least 2 months later. And to me, that kind of makes me a bit anxious.
And lung issues,
where their lung capacity is not the same 2 months later. We don't know how long that's going to last. And to me, that's one of the more concerning.
I also asked the doctor about sterility in men. Can the coronavirus have an impact on that? He did say that the virus can be traced in sperm, but it's too early to tell right now if it's actually going to have long-term effects. At UNM Hospital, Brittany Hope, KOAT Action 7 News.